On.
Okay. Hey guys, my name's Kelly Clark, and today I'll be presenting my Capstone project, providing education to pre-surgical patients, with the focus here being that the education is provided before the day of surgery. So let's get started. So what are some objectives of the Capstone presentation? Well, the objectives are going to be to focus on the needs for pre-surgical education. Patients should be given some amount of education prior to the day of surgery to help alleviate fears and anxiety. When education is given before the day of surgery, patients experience more retention of information given and will have better postoperative outcomes. In addition, less phone calls to physicians for clarification will be needed. And finally, evidence-based practice initiatives will be reviewed for nurses working in the pre-surgical and pre-procedural areas to give better overall outcomes for our patients is the goal. And why is education before surgery so important? So in 2010, 28.6 million ambulatory surgery visits occurred, and preoperative education leads to 20% improvement in postoperative outcomes. So ambulatory surgery is growing vastly across the United States, and in addition, more and more procedures are now being considered as outpatient. So these bigger, more complex procedures, such as a total abdominal hysterectomy, are now considered outpatient, and these patients will not be permitted to stay in the hospital overnight. So what that means for us is, with the growing amount of patients going home after surgery, a real need has been made for clear and productive education to be given to these patients before the day of their surgery. So according to Spalding, preoperative education leads to improvement in postoperative outcomes. So why is education before surgery so important? So each surgery will have different requirements and expectations. Improved knowledge retention of what to expect postoperatively may help reduce patient anxiety, and then obviously we always want the increase in overall patient satisfaction. So nurses in the preoperative and pre-admission testing areas should have a base knowledge of the differences in severity of procedure. Some typical recovery times should also be known, and then specific requirements for different procedures should also be taught to patients before surgery. Some procedures may require a bowel cleanse, while others may require no change in diet at all. We can teach our patients about what to expect on the day of surgery to help alleviate fears from the time they arrive, the preoperative expectations, then into the OR, finally PACU and discharge lounge. A brief review of what they will encounter and what to expect should be gone over, along with surgery-specific instructions. So what sort of education can we provide? We want to be as specific to the surgery as we can, what they will expect, and then what to expect on the day of. Some procedures have specific videos that they can watch. We have this for our orthopedic total joint replacement, is a video that they are required to watch before they come in. These educational videos are easy for the patients and their family to watch together. They help increase knowledge retention and also gives quite a good bit of educational material. Each patient should be given some sort of printed handout instructional materials that they can refer back to during their recovery. These materials will help avoid the patient calling the doctor's offices repeatedly for clarification. So for this recovery expectations, we need to make sure we go over things, immediate and long-term expectations. What will they expect immediately when they get home, and then also what's going to be expected in the long term. And then materials, obviously printed materials to have at home. Every single patient should always get a packet of discharge instructions that they can continue to refer back to. So an overstone of the Capstone project, when I started this Capstone project, I proposed a peacock question, which is, in preoperative patients, how does a lack of education compare to preoperatively educated patients? And how does this affect postoperative outcomes and patient satisfaction when the education is given before the day of surgery? So we did do an exhaustive literature review where it was conducted to determine what research has already been done regarding pre-surgical education. Limitations were set using certain criteria to help filter out unnecessary articles and focus in on the most pertinent information related to this topic. The most relatable articles to this subject were then chosen. So we did two-part, the literature review part one. Evidence-based practice guidelines have not been made regarding pre-surgical education. So the review of 2 separate literature articles was conducted in lieu of guidelines for this practice. In the first research article, Collins used a retrospective analysis of patient attendance at our pre-surgical classes and then assessed the impact on the number of calls received in relation to either patient reassurance or complication-related issues. So that was the first part that we did. Some goals of the research were to enhance patient access to procedural info, and then as a result, the calls made by patients who attended the pre-surgical class were significantly lower than the patients that did not attend the pre-surgical class. And in the literature review part 2, we have a single descriptive study approach to determine the effects of take-home educational video that is shown to patients prior to surgery. And this study was done by Gadler. With this also being a quality improvement article, the focus is placed on improving the current problem, which is the lack of education being provided to pre-surgical patients. The results did conclude that the majority of recipients in this study were satisfied and that the educational delivery method was retained well. Information acquired regarding specific postoperative expectations and activities was retained. So the results, patients were satisfied and they were able to retain the information when given before the day of surgery. So our conclusions from the literature review are that educate. When we educate the patients, we provide sufficient education to surgical patients before the day of surgery for maximum retention and decreased anxiety levels. And then we can assess this. We're going to assess the effectiveness of given education by following up after surgery with satisfaction results, surveys. And then we can monitor this. The preoperative patients can be monitored before, during, and after surgery to help determine effectiveness of their preoperative education and how well they did retain it. You guys have any questions?
We should go over this with PAT.
Yeah. PAT, okay.